And I think, if I was to summarize what AI Med and this whole realm needs to do is to move that clinical utility faster and more effectively. Because the future of all this is not just any one field. It's not just Moore's law and mobile computing and AI, but it's this convergence play of everything from blockchain and 3D printing to synthetic biology. It's at the convergence point, also the convergence of different communities, the partnering aspect that's going to really move things forward. And let us address the grand challenges we have across healthcare, from rising costs, aging population. Access is a big issue, and AI can play a role in that. There's a shortage of doctors and nurses and specialists in most parts of the world, even rural California. So no matter what happens to Obamacare or Trump care, which is really no care, or Putin care, which is probably what we're getting, we have an opportunity to use AI machine learning to bring care around the world. We have challenges, as I mentioned, in exponential data, but making that actionable information, getting rid of all the fragmented fax machines and inefficiencies. We heard about even some startups addressing that. And then how do we help our friends in the regulatory world, the F word, the FDA, get out of their linear mindset? We'll talk more about that, and help our friends in the payer world, help catalyze and take, whether it's a new AI chatbot or platform to move things forward. So I get a little bit of a chance to be at this convergence point. I've been the chair of medicine at Singularity University since it started 10 years ago. Anthony came to, I think, our second exponential medicine program called Future Med at the time. We were about 100 of us. And part of the magic of that program, as it's expanded exponentially, is to bring folks from all sorts of fields, just like here, to look at this cross-sections, not just in any one bucket, not just AI, but what's happening in robotics and synthetic biology and nanotech and drones. And we have a pretty interesting time there just down the road in San Diego every fall, and Anthony was kind enough to do one of our keynotes, that really helps catalyze some of this new thinking and a lot of new partnerships internationally as well, particularly with 44 countries. Something that's been done well in the NHS can translate to here, or something that's been done in Latin America. So a lot of the future medicine is unsiloing and sharing across these elements. So some pictures from Motel Del, and I think there's Anthony this year kind of inspiring and educating this broad spectrum about what's happening in the AI med space. And we even had for the last 3 years, the head of the FDA's digital health side, Bakul Patel, come and learn from the community and also help inspire the FDA to now launch some new solutions, software as a medical device. I think there's been a dozen or more companies and startups and platforms that have been approved with AI as a component in the last year. So that's a bit of my preamble. We're going to try to talk about partnerships here. And again, I think it's this convergence play and bringing together industries, patients, technologies. That's really the future of medicine, is not any one organization, but how we can all cross-fertilize and accelerate things from where we are here in 2018. We want to be like Wayne Gretzky and skating to where the puck is going to be if we're going to really bring us a faster, better future of health and medicine. Given that, and it's already been used as a quote here, I think, that the future's already here, just not evenly distributed. And it's all of us in this room and our relationships and our partnering that's going to really help us not just predict the future, but create it together. So with that sort of preamble, we're going to go down the line of our panel. We're going to start with Dale and introduce himself and share what they're doing, and then we'll cross-fertilize from here. Dale.
But before I get to the slide, first of all, thank you, Dr. Chang, for inviting me. But the first thing I have to do is disagree with you. You had a slide indicating that we were in an area where the regulatory infrastructure seemed to be okay, but we were about to hit a point where it wasn't. And I'm here to say that we're actually not okay. So we're in an environment right now where technology has, has moved beyond, in terms of what it allows us to do, what it allows patients to do, the regulatory infrastructure. And what I want to emphasize here is that when we talk about the regulatory infrastructure, and I'll get to my slides in a second, we're really beyond FDA. FDA is a big important part, but when you think about healthcare, in order for anything in healthcare to work, it has to be, number one, safe. And the regulatory infrastructure helps us do that. But the other thing it needs to do is it needs to be deployed in a financially viable environment. And we in healthcare regulate how things get paid for in healthcare massively. So we have a regulatory environment that right now does not effectively address health and safety when it comes to technology in healthcare, and it also doesn't create the kind of reimbursement environment we need to see a lot of this technology in place. So we are already in trouble when it comes to information technology and healthcare. So we are already behind. It is going to get worse. That's the big problem. Okay, so to my slides, I'm going to suppress my instinct as a lawyer to talk endlessly about something I don't know anything about, to speak efficiently about something I do know about, but I still need notes. I'm not going to go through the slides per se. It'll all make sense as I talk about this, assuming you all can read. But when we talk about the legal environment as a general matter, we're talking about an environment that is really primarily focused on risk mitigation, right? Everybody, corporations, individuals, healthcare systems, everybody focuses on risk mitigation. As clinicians, we like to not think about that. We like to think about how we improve people's lives, but everybody behind you is thinking about risk mitigation, right? That's one factor. Another factor is a very common principle in the U.S. in the U.S. legal system, which is sometimes referred to as buyer beware, caveat emptor, kind of comes out of this informed consent notion, which is if you know enough about something and you make the decision to purchase it, buy it, use it, then the responsibility is yours, right? It's not going to go back to the person who's given it to you. If you know enough, it's your responsibility, right? All of that ultimately rolls down in the healthcare setting to an environment where a doctor is talking to a patient, right? By the time you get to that point, the patient, the doctor, the institutions that have purchased this technology, that are using this technology, everybody has done their risk mitigation strategies. They've informed appropriately everybody so that they can have their informed consent, and they protect themselves from risk, right? So you get down to the point where you have a doctor and a patient in a room using technology, using information, and you have this architecture of informed consent behind them. The real problem here that I see when it comes to that environment is that nobody actually knows what they've consented to. Who actually reads the licensing agreements when you accept an app? Who has actually read what the FDA has said it has cleared a device for when you use that device or that app, right? We tend to gloss over those things in our natural life, accept them, think that we know what they do, think what we know what they're supposed to be used for, and start applying them. That creates remarkable complexity from a legal perspective when you actually get down to that last mile of healthcare delivery, a patient talking to a doctor, right? Doctor doesn't know what the device is. Doctor doesn't know what the information is, where it came from, doesn't know what the device necessarily was cleared to do, for example, by the FDA. And you create an environment, therefore, where there's an actual ton of legal confusion, where you may actually be in a place where the patient, the doctor, feel that there really isn't that much confusion. Oh, I've got all this great information, I know what to do with it. So, who's responsible for that last mile of healthcare? Well, it's the medical boards, right? The people who oversee the practice of medicine and what the practice of medicine actually is. Medical boards are in a very difficult position right now because the law, as I said before, really has not kept up with technology. What the practice of medicine is with all of this technology is changing factually, but it's not yet changing legally, right? That creates a lot of risk for doctors, it creates a lot of risk for patients, and it creates a lot of confusion for people like malpractice insurers and for the institutions that are worried about these things. It comes from the evolving expectations from the consumers, right? Patients buy all this stuff. Great, I got this thing, it's feeding me all of this information, I'm gonna send it to my doctor. My doctor's gonna know absolutely everything he needs to know about me, and I'll be able to go and get great health care. Well, it doesn't actually work that way right now. Can't work that way right now from a risk mitigation perspective because doctor can't look at all of that information that comes in from all of the patients. It's just way too much risk. It's not practical. It's not practical physically can't look at all that information. But we're creating expectations right now where all of that happens, right? So, when it comes to partnerships, it comes to thinking about who we need to talk to, we need to talk to the regulators who regulate the practice of medicine. We need to involve the medical boards, make sure that they understand what's going on out there in the world so that they can be both responsive in terms of their regulatory authority, but also responsive in terms of being able to communicate to their constituents, educate them as to what's going on, and hopefully arm them with their best practices. So hopefully I've kept that to 5 minutes. Okay, very good.
Thanks.
Hello, good morning, everybody. My name is Bella Zaghi. I'm president of Southern California HIMSS, and I also work in Cedars-Sinai Medical Center as my full-time job. So a little background about HIMSS. It's a cause-based nonprofit. It's founded over 50 years ago, and it's grown from a national scale to a global scale, so there are chapters all over the world now. The membership constituents are from medicine, healthcare, they work in finance, strategy, so we really cover a lot of the base, and we've contributed to research, health policy, professional development. There's a lot of education going on with HIMSS, and we're really trying to improve healthcare through information and technology. So AI is a new area of growth. We started to see more in 2016 at our national conference that we have every year. So there's a huge exhibit hall. It's as big as like a football field. And we started to see a little more startups there that were working in AI. And then also last year, AI's presence grew, more sessions on AI and machine learning, more vendors that are working in AI. So it's a new area of growth, and we're looking to expand in AI. So the thing is that because we're looking into technology that is improving health, AI comes under a subcategory, so it's more of a type of innovation that is being used to transform healthcare. So we look at it as innovation, and innovation is a big area for HIMSS. So nationally, we just started to engage with the National Science Foundation. So I know some of you are not from the United States or this country, and you might not be familiar with the National Science Foundation. It is a federal agency, so the government provides funding for this agency, and they provide funding for research and education in science, so in engineering and mathematics, in basic research. So the National Science Foundation in 2016 came up with a strategic plan in artificial intelligence. They saw that artificial intelligence is an area of growth, and a lot of development is going on in AI. So they came up with a strategic plan. They have a budget of around $8 billion a year. So you can imagine how much research is being funded by a National Science Foundation. So back in 2016, under the previous former President Obama's leadership, they came up with a strategic plan, and in 2018, they came up with an RFI, which is a request for information for anybody, any group to come and provide any additional feedback on the strategic plan, because they're gonna start to modify it. So HIMSS came and wrote a letter to the National Science Foundation with some feedback, mostly providing support for AI and the potential it has to transform healthcare, and also to encourage them to support research in AI and basic science research in AI. So again, we came up with this letter back earlier this year in 2018, and we're going to have a meeting with National Science Foundation around March after the global conference in February. So we're always looking for feedback from our membership or anybody in the area of health IT if they have any ideas, or if they have any feelings about about AI and what they any advice or suggestions, we're always willing to hear from you and then come back to the government officials and National Science Foundation and provide that feedback. We're also exploring a public policy principle in AI, so similar to what Dale said about regulation. So we want to avoid regulations with AI. So when we do advocacy and we go to government officials, representatives, and to senators, we're going to encourage them to try to keep some space and avoid regulations with us. So the Learning Center has a lot of resources in education for AI. Last month was actually AI month, so there were several articles. And then the national conferences, as I mentioned before, they featured sessions on AI, and actually we're having a pre-conference symposium, which Dr. Chang is going to be giving the keynote presentation on February 11th. So we've really expanded on that. And SoCal HIMSS, so again, Southern California is a chapter for HIMSS, and we have over 3,200 members. We have a couple podcasts in AI, so you guys can listen to that on it's on iTunes, so you guys can listen to those podcasts. And then also our conferences have featured panels on artificial intelligence from 2016. So you can also watch our panels they're all on YouTube. And we're always looking to improve technology and to improve patient care, and AI is a way to transform healthcare. So we're looking forward to seeing more development with that. Thank you.
Hi, good morning. My name is Ellison Kumar. First of all, thank you so much for having me, and I've been really enjoying all the talks and seeing all the excitement around this developing area. A little bit of my background and where I come at from this conversation is I was with the FDA for 10 years in the Center for Devices and Radiological Health. I was in the Office of the Center Director helping to develop a lot of the policies with the implementation of the 21st Century Cures Act, but also before that, innovation policy in general. So how can the FDA meet medical device developers halfway in areas of unmet need or emerging technological areas where FDA may not have the knowledge base or the resources, as well as companies who are living it and breathing it every day. How could we make the regulatory environment more friendly? So I am very much a proponent of using technology to better inform healthcare decisions and bringing necessary medical implementations towards patients. A lot of what has been discussed over the past day and even this morning was around clinical decision support and using software, which is not a new concept for FDA. So they've been doing that for a number of years already with software-based algorithms to help clinicians amass the data and make informed decisions with a little bit more insight into what's going on with those patients. They've been using it for triaging patients on morning rounds. There's the Hero device, which was out over a decade ago for pediatrics. And so the concept of integrating data with healthcare is something FDA's been familiar with. However, they have been a little bit more advanced in the past year or so with actually putting the term AI and machine learning into the intended uses of medical devices. So they're actually relaying that there are advanced software algorithms in the products that help render a diagnosis. For example, the OsteoDetect device and the IDX device that were put out today, they're both imaging-based AI frameworks that allow for the detection of fractures and sprains for the OsteoDetect, and then diabetic retinopathy for the IDX product. And in the indications, the FDA actually use the term, the company asked the FDA if they could use the term AI-based or machine learning-based diagnostic. And I think we're going to see more of that, but again, that's not the first time that they've been used. We have HeartFlow and companies like Arteris that have been utilizing their AI platforms for other detection and diagnosis of medical conditions over the past several years. But I think a lot of the support has come about both with the current FDA administration, led by Dr. Scott Gottlieb. He is a huge proponent of using big data and digital health approaches to support industry and coming out with advanced technology. He was named one of Time's 50 most influential leaders in healthcare, and I'm going to get that wrong, and I'd really like to get it right, so I'm going to read it if you guys don't mind. 50 people transforming healthcare in 2018. He was also Fortune magazine's #6 world's 50 greatest leaders in 2018, and I think that says a lot for a government appointee in today's administration to be named #6 as one of the world's greatest leaders. And one of his specific quotes that he's made is, one of the most promising digital health tools is AI, particularly efforts that use machine learning. So you guys have a huge cheerleader in the Food and Drug Administration towards developing these types of technologies to help patients in advanced healthcare. The 21st Century Cures Act, which was enacted in 2016, actually facilitated the Office of Digital Health, what's in CDRH, which Bakul Patel is the director of that office. He was mentioned earlier, and he has grown that program, hired data scientists, which are very hard to hire within a government organization due to the extreme competitive marketplace for people that have that type of knowledge, as well as software developers, to come and support FDA's pre-market evaluation of these type of products. He also brought about the new regulatory interface on determining what is now considered a medical device and what is not considered a medical device, or what may be regulated based on a risk-benefit framework and what is actually going to be under regulatory enforcement discretion. Whereas, sure, it's a medical device, but it's actually such low risk that, we're not going to actively enforce regulations on it. So that was all enabled through the 21st Century Cures Act. He's also facilitating the pre-certification pilot program for software as a medical device. Software as a medical device was adopted by the IMDRF framework. It's based on types of software, what the software does, and the pre-certification program is really looking at ways to reduce the regulatory burden. We all know that software advances very quickly, especially in an AI-based framework, and it learns. And you want to be able to implement that learning as fast as possible for your patients' benefit. And so what the FDA is actively trying to do is reduce regulation and heavy oversight as the more traditional medical devices, hardware-based or tool-based devices get. Breakthrough designation is also something that is afforded to novel medical products. They allow for really an expedited conversation, and with the thought of taking really breakthrough innovation, getting it out to products faster, you become very collaborative with the review team and just in hopes of reducing the regulatory time that it takes to get a product to market, with more transparency in what the FDA is going to ask for in evaluation of that product. So I'm going to stop there and look forward to conversations on the panel.
Awesome, thanks. So touching on two things, talk about educating, like through HIMSS, and then you've got the regulators and the legal side. How do we educate who makes the sausage, right? Often it seems like the Senate is run by 20-year-old staffers. They may be on top of this, but how do you educate the regulators within the FDA without, and then because that often drives what happens next. Any insights on how do we move this movement forward through that piece?
I have one thought on that. I think it's no secret to anybody that some of the smartest people developing may not reside within the FDA. And there does need to be that education as you go in with a new idea and start talking to the agency about it. I'm not saying there aren't smart people. I'm just saying you guys know more about your product than they do when the conversation begins. It's very important to be transparent and to know how your product is making the decisions it does so that you're able to relay that information to the agency in a way that they can understand and they can relate back to decisions that they have previously made. The easier that you can do that, the more transparent you are with how you gather that data, how you intend to validate that data, will help them come to a decision faster and help them understand the product in a way that can translate beyond just what you're doing as well.
I think one of the challenges we face in the face two kind of challenges in the United States when it comes to healthcare and how do we educate and who are the right people to educate. One of the problems, there's actually an interesting analogy here maybe, but one of the problems that we have in healthcare is that it is the most regulated industry in the world, easily. We don't regulate nuclear power plants as much as we regulate healthcare. That comes not out of some ambitious, bureaucrat's mind. It comes from the fact that we regulate every aspect of healthcare delivery and payment, right? And we do it at a federal level and we do it at a state level. So we have a system where you may say, well, gee, and we work with people who are developing solutions all the time, and they, if they're smart, they're thinking, what kind of FDA strategy do I want to have, right? Do I want to go to the FDA now? Do I want to wait? What do I want to get it cleared for? Really smart organizations are saying, gee, maybe I should be thinking about the parallel process with CMS so I can get my device approved for reimbursement at the same time that I go and I get it cleared to be able to go out and market it in a certain way. Those are just two bits of the regulation, right? It doesn't really go to, and you really have to think through as a developer, all of the other things that impact whether someone's going to make a decision to use it, right? How is this going to, is this technology going to change how I satisfy the conditions for participation in Medicare, right? Is this thing going to impact my medical malpractice, coverage, right? I mean, you just go through thousands of questions about the implications. So from a policy perspective, you really need to be able to be communicating across the line. And we just don't have a legal environment where we do that, right? We don't control everything centrally. So we have to talk to lots of different people. So that's one big problem. The other big problem is that we don't, as a general matter in the United States, and I think we should change our thinking about this. We haven't in a long time in the United States felt the need to really bring government and industry together to achieve something. There's a great analogy we hear way too much of, which is the moonshot, right? But everybody forgets what that took, right? It took real partnership between government and industry to be able to do that. And so we talk about moonshot, we create these committees and meetings and all of that. But what we haven't done, and I think we should be thinking about doing in artificial intelligence, goes beyond healthcare, is thinking about getting serious about a national strategy and work toward that, as opposed to saying, well, gee, how am I going to get my, this sort of image reading technology out there, right? That's tiny little piece, and you're not going to convince all of the different regulatory bodies that you're right in an easy manner.
I have something to add. So I think also echoing Allison's comments about educating the people that are making the decision, so the government officials, like you have to understand their perspective, their background. When we meet with them, when advocacy meet with them, we have to think of okay, they come from like political science. Do they understand data science? Do they understand like how this is going to affect processes? So we really have to think of ways to educate so they understand different ways, like try to have analogies and try to speak their language. So I think that's very important, and I think it all starts from there. It starts with the representatives, the senators. They're all making the decisions with regulations. So I think that it's
speaking their language, I think,
yes.
is the right. I mean, one of the things also everybody needs to be aware of is that no one is interested in spending more money, right? So whenever we talk about this, we need to be cognizant of the perception, right or wrong, that we spend way too much money on healthcare.
Well, ideally, some of these new tools will bend the cost curve down. Right now, at least right now in Congress, there's only a single PhD. The rest are non-science folks. So how do you communicate to these folks who make the bills is a challenge. I love the moonshot analogy because, yeah, we went to the moon. It wasn't just NASA. It was Boeing and Lockheed and everybody coming together, and we still need the collaboration. I mean, so what about sometimes, avoiding regulation? Some of these devices, technologies start outside of that sphere or go to countries or other parts of the world where there's less regulatory barriers and can get proven out. Sometimes might leapfrog the United States. Some cases, do we have different paths to partnership and avoid the spectrum there?
So I'll offer up a thought on that. Because of course lots of my clients want to avoid regulation, and I think that there are lots of reasons to do so. But at the same time, you're never going to get away from regulation in healthcare. It's never. I think we've gone, no matter the political leanings. I don't think the most, right-wing libertarian would ever say that anybody should be able to claim that they're a doctor, right? So we're always going to have a regulated environment. And so to me, it's a matter of thinking about, well, which regulatory structure and problem that we face really should go away versus which ones should we embrace, right? And say, this is actually a good regulation and we should be, as an industry, embracing it in some way. I kind of point to the 21st Centuries Act. You mentioned and the CDS bit of that legislation, which basically, for those of you who don't know, that said that certain clinical device software will not be deemed a medical device, right? It's outside of the regulatory environment completely if it has certain characteristics, right? And they're fairly complicated, I won't go into them. Personally, I thought that was a huge mistake for industry to push that along. Because now you have something, right? Okay, you avoid having to go to the FDA, right? What doctor's going to use it and rely on it, right?
Yes.
The FDA hasn't looked at it. Nobody has, right, given it that official stamp of approval. And there's one thing we know about healthcare, right, is that we need that official stamp of approval in order to get paid, in order for people to feel comfortable about it. So it's those sorts of things I think we need to be mindful of within the healthcare industry, that some regulation is actually, really good. Some of those things we may actually really want to embrace may be that we want to make the process better. And I think FDA has Scott Gottlieb is the second best thing about the Trump administration. The first best thing being the jokes, right? And there's Scott Gottlieb.
Who knew healthcare was so complicated?
So I actually have a great example of what the issue that you just said. And it really, within that example, and Sharif, I hope you don't mind if I tell this story. So I have been working with Cognoa and interfacing with them, with the FDA. And when we first went in intending for this app to be render a diagnosis of autism for a patient, FDA had a very different opinion, as we did, as to the clinical utility of a product like this. And kind of using the 21st Century Cures Act, oh, this isn't a medical device. What? We're rendering a diagnosis. That is the definition of a medical device. No, not really. And so it really, what I would, and the there was petitioning on the company's part to say, please re-examine this. Please look at our data. Please understand what we were doing. Please, please hear from the clinicians as to how we are using this. But the whole point of doing all that was a pediatrician will not pick this up and use it. The American Academy of Pediatrics will not endorse this product if the FDA, you have not given it your stamp of approval. And to a company, that could be the difference in clinical adoption in a healthcare environment and nothing. So while some people are of the camp, oh, thank God, I don't have to go to the FDA with my product, other people are like, please, FDA, like, I'm going to demand that you regulate me. And I think that with the case of Cognoa, it goes to show how dedicated they are to this space and how much they want the quality to exemplify their product in delivering that healthcare to patients. And so I would encourage any company that cares that much to continue to petition FDA to regulate their products to your point. Eventually, FDA did come around and agree to regulate it and even granted the product breakthrough designation. So I think it's a testament to what can be done if you work with the agency, talk their language, and really work within that risk-benefit framework in a way that shows the quality of your organization and the product that you're making.
No, it's interesting. It sounds like a selling point, like FDA approved, so yeah, you should adopt my product. So.
Yeah. It was painful. I mean, we'll admit that, but.
So in the last few minutes, to cycle back to the realm of the partnership piece, like, HIMSS is, one of their big missions is, fostering interoperability. We often need interoperability between regulators and AI, machine learning, and data sets. Any thoughts from any of you on sort of how do we connect those dots to get people to play in the sandbox in better ways? It might be the regulatory side, it might be the clinician side, the payer side, because it seems like there's a lot of potential, a lot of silos, and sometimes things that work, but aren't yet manifested because folks aren't playing well together. Any kind of lessons there?
I would argue send everybody to HIMSS Conferences is a good first step. And she's not paying me anything for this, by the way. But they're great conferences. And I think that that's an easy way. We hosted in our DC office not all that long ago. Dr. Chang was with us, which was fantastic. A meeting of state medical boards to talk about artificial intelligence. And the whole point of it, and it was sponsored by the Federation of State Medical Boards, and to get together to try to educate their regulators. And that's a good first step, I think, because when you talk to regulators, when you get out of the legislative side and you talk to the actual regulators, they're trying to, their burden is great. They're trying to implement, right? All they can do is implement the law. Legally, that's all that they can do. So they are captured by that, but they are trying to push things forward as much as they can if they see a value and a benefit to it, right? The old saw of, you want to get no for an answer, ask permission, right, from a regulator. Yeah, it's true to a certain degree because a lot of regulators are like that, but you get through to the higher levels, the people who are thinking on a policy level, they want to see this stuff work. They just don't necessarily know exactly how it will, and I think it goes back to the importance of speaking their language, right, understanding what it is that they're trying to do. If you go to CMS and you say, well, we should be able to, create this structure that allows us to, pay kickbacks to doctors, that's just dead on arrival. Sorry, it's just not going to happen. That's the law, right? And you can't have a regulator approve something that's, right, contrary to the law. So you need to be able to understand that perspective. You also need to understand, in my view, the overriding concern from a policy perspective is that combination of cost, quality, and access. Even though we're in a different administration, those are still the three driving forces. So if you can present a solution to those three things, then you'll get people's attention.
So echoing your point about the HIMSS conference, it's a great crossroads to bring folks from different places in healthcare, finance, front end, back end, nurses, physicians. So it's a great way for them to converse and to think of ways to to foster interoperability and foster a relationship and a partnership to work together. I think interoperability is a great goal, but it's so difficult to do, to have all these systems connected and communicate with each other because of the standards that they all have. I think that's the golden ticket with healthcare in the next few years, is just finding that connection between all these different systems. So.
We've got like 3 minutes left. Any questions from the audience? One right there.
Making an analogy of healthcare being like medallion yellow cabs, AI is maybe Uber and should go just create the new thing and push it out there and just have a whole new parallel system that suddenly, oh my God, woke up, we have a new medical care system that is with AI, and the FDA will have to catch up. I'd like to hear thinking of it in a whole different way, because we've had the arguments of whether they go to the FDA like Cognoa did versus other groups who started earlier who just did it, and both are arguing, you're right, they don't say FDA approval, but they did it, and it's working, and people accepted it. Maybe there's a whole element that could be like Uber, just taking over and almost making the old part go away. And I think that's part of where we're going. I'd love to hear it discussed that way.
You got to remember that when you go to the FDA, what you get cleared for is the ability to talk about your product in a certain way, right? So you can't really have a healthcare system that uses, classic medical devices that haven't gone through the FDA process, because that would be just flat out illegal. Now, what I will say, though, in terms of your comment, is that there are opportunities. One of the good things about our healthcare system is that it is not one healthcare system, right? It is many, many, many different healthcare systems, right? So you can work outside of the most regulated, which is Medicare, Medicaid, and work just in the private market, where you're dealing with a combination of insurance products and employer plans. They have a little bit more flexibility, particularly the employer plans. And quite frankly, we see a lot of the early stage companies go that route, right? It's easier to talk to, some company that has a workforce of 5,000 and say, hey, we think this product really works very well. We've got our FDA clearance. Let's get it out there. Let's see how it goes. There are also, organizations out there that are taking a different approach, or they're taking themselves completely outside of the third-party payer system and delivering healthcare in much more of a, just a cash-based approach. And so they have the opportunity to prove the value, right? As you said, that's absolutely right. A lot of this technology will reduce costs ultimately, and you have that opportunity to do that. So, we can do it. We just need to think about what it is that we're avoiding, right? Unfortunately, you can't avoid the FDA. Or regulations.
And Uber did some things that weren't legal at the time. They certainly were disruptive by connecting a lot of these dots to meet an unmet need. So I think part of the opportunity of this AI med community and beyond is to bring folks into the fold, meet those unmet needs, and catalyze AI, machine learning, and beyond to bend the cost curve and improve prevention, diagnostics, and therapy. So it takes a village. So with that, I want to thank our panel, and let's go off and create the future together. Thanks.